Hi, I'm Dr. Paul, and welcome to the best of Baggers Blogs. This week, we're going to be looking at
local anaesthetic facelifts and eyes. I've rebranded what we do here at Define Clinics. Traditionally, I've always done the Define L-lift, which is that cut that comes here and down here, maybe occasionally behind the ear a little hockey stick. And I've advanced that over the years to be a really very, very good procedure. But now we're going to just have several grades of the Define L-lift as I've advanced it even further. So there's going to be a basic, it's not really basic, but we're going to have a mini Define L-lift through to a full Define L-lift under local anaesthetic, which may include liposuction as well as a neck lift. As far as the eyes are concerned, let's talk about eyes. Eyelid surgery is advancing all the time. And again, Dr. Paul and the Define Clinics, we've devised a rating scale for eyes, and we can perform local anaesthetic surgery on your upper eyelids, so you get like sort of mini bags there, in that little bit there, so just a little bit of extra skin, down to full eye bags here with festoons. With the new plasma pen, we can minimise, we can't take them away, some of the problems that you've got, particularly the lower eyelids and the festoons down here. So we're going to have combinations of treatment with the plasma pen and surgery. It's local anaesthetic. Recovery time is really quick. Complications, of course, infection, bleeding, scarring, all those kind of things are important. But there's some views of befores and afters here that we're going to show you, where the scar is on the upper eye and the lower eye. Also the plasma pen and our sister site at Avita, some views and some photographs on there as well. Local anaesthetic is something which is very amenable, very approachable, very easy. Recovery is really good, and we can do an awful lot now under local anaesthetic. And I'm doing more and more under local anaesthetic. So if you want some help with facial rejuvenation, eyelid rejuvenation in particular, give us a call.
So, we're going to talk today about weight, and I have been looking into some of the latest issues around weight and weight issues, both underweight and overweight. Now, it might be perceived that eating disorders are things that you just need to give your head a shake, have a word with yourself, get yourself sorted and sort yourself out. There's a massive social stigma with underweight and overweight, and the attitude has been that if you are overweight, it is your own fault. You're lazy, you eat too much, shut your mouth, stop eating, exercise, it'll get sorted. What is being realised now though is that weight issues are multifactorial. Now what that means is that there are many layers to weight issues, both underweight and overweight in men and women, all ages. It isn't just a physical problem. It is a psychological problem. It is a chronic illness. Now, if you have diabetes, you get treated for your life. If you have blood pressure, you are treated for your life. If you have thyroid, like I do, you are treated for life. But if you have weight issues, it seems that you get treated, stop, get on with it. We are now realising that weight issues are chronic illness and you need chronic treatment for life. And this comes about because there is believed to be what they call a weight set point. And that weight set point marks the point at which you are going to weigh. That's where you're at. So if you're 10 stone and you can eat like a horse and you stay 10 stone, that's your set point weight. If you are 19 stone, even if you lose weight, come down to 10, your body still has that weight set point at 19. So you're always battling with that weight set point. So this is where people say, I've been this size, I've always been this size, and I can't change for it. They're actually not wrong. I used to think that it was an issue where, what do you mean you can't change? Of course you can, just stop eating. But it is very complex, this whole weight issue. So what they're advocating now is that it's a psychological issue, it's a physical issue, there's this physical set point, so we need to monitor that. You need to have medication perhaps to help you, things like Victoza, liraglutide, weight reduction schemes. It's not just about a lifestyle change. Yes, that is part of it. Yes, it is about getting to the backside and doing something about it. Yes, absolutely, there are always those things going on there. You can't expect to get to where you want to be just by sitting around doing nothing, okay? So it's you and us. So we can help you, but you've got to help yourself as well. And it's that realization, it's like any addiction, you need to accept the fact that you've got an addiction. And that addiction is to either be OCD not eating or OCD eating, comfort food, abusive relationships, massive impact upon weight and body image. So we need to work on it from the physical, medical, doctor point of view. We need to have medics, nurses giving advice. We need to have counsellors helping with it, dietitians. All these people need to come together to help people with weight issues. So my message for today is that weight is multifactorial. Weight is an issue. Weight is a problem. We've kept away from all the medical side of what happens with weight issues. I'm talking about how to get you to that different set point. So if you need advice, if you want help, if you want me just to talk to you, if you want a multifactorial, multidisciplinary team to help you out, I've got it here. Give me a call, we'll do our best. I can't guarantee results because it's down to you at the end of the day as well as to me, but we can fight it together.
I'm Dr. Paul. This has been the Best of Baggers blogs. See you next time.